We're continuing our series In the Know this week on Pregnancy 101. Being pregnant can already be a stressful time for most women, let alone expecting a baby in the middle of a pandemic. Pregnant women are not immune to contracting COVID-19. According to the Centers for Disease Control and Prevention, there have been tens of thousands of cases of pregnant women with COVID-19 reported since January, and unfortunately, dozens have died. We caught up with Dr. Jeffrey Thomas, OBGYN and Chief Medical and Quality Officer at Community Regional Medical Center, to help shed some light on some of your biggest questions. Thank you so much to Dr. Thomas for joining us today. We are talking about pregnancy and COVID-19, certainly in this unprecedented time that we're living in. Doctor, what do we know in regards to this virus and the ties to pregnancy?
Boy, this virus, we are learning more and more every day, both about non-pregnant patients and pregnant patients. There's a lot of scare, obviously a lot of sensitivity when it comes to pregnancy care and how will such an unknown affect my baby, how will it affect my delivery and the care I receive thereafter. So we're learning every day, we're studying patients every day, and hopefully going to protect our population against the ills of coronavirus.
Do we know at this point if pregnant women are at a higher risk of contracting the virus?
Initially, it was thought that the pregnant patients were immune compromised and probably at greater risk. Early data did not support that. There was some new information that came out not too long ago that pregnant patients actually have a higher rate of ICU admission and being on the ventilator. However, that does not translate to an increased mortality. In fact, the mortality rate from the flu virus H1N1 was significantly higher for pregnant patients than coronavirus based on what we know at this time.
Wow. So what do we know in regards to the unborn baby? Say mom does get the coronavirus, can the unborn baby get it as well?
Currently, there is no evidence to support vertical transmission, which means transmission of the virus through the blood to the unborn baby. The biggest risk right now is if an infected mother does deliver, that through respiratory means she could infect her baby after delivery, but that still isn't completely panned out. There has been evidence of newborns and neonates that do have COVID, brings to point a lot of controversy about breastfeeding and contact with the baby after delivery. Avoid COVID like the general population, masking, hand washing, social distancing, keep up with your prenatal care, understand that there might be some arrangements as far as telemedicine or mechanisms for you to receive information in a non-traditional fashion. Follow the guidelines at the hospital at the time of delivery. Certainly there are implications for visitors and that sort of thing. And you should receive standard recommendations for your care of the baby after delivery to protect you and your family from becoming infected. What we recommend for any patient, pregnant patients most especially, would be, to become educated, read the right information, certainly consult the Centers for Disease Control, American College of OBGYN, and American Association of Pediatrics have great patient resource pages where you can become educated and understand the reality of your care. Not knowing and being concerned and getting your health information online through non-medical means can certainly create anxiety and confusion.
Excellent. Thank you very much, Dr. Thomas.